Good morning to everyone. Just a second. So I hope I'm audible, visible. If yes, I'll start the session. Good morning to everyone. Yeah, I think it's audible, visible. So hello to everyone. I'm Dr. Ashish, and obviously we are having a physiology class right now. The first session, first day. And you all know physio is a very basic subject, but basic subjects are the one which sometimes appear the most difficult in the exam, because either you understand it or you don't understand it. The chance of mugging or just knowing it is difficult because everything is correlated with each and everything. So that's why we are, one second, okay, there's some issue in the app. Just give me a minute, okay, some issues, okay, just a minute. One second, okay. Anil, मैं कर दी ऑलरेडी स्टार्ट. हाँ, ओके. I'm just waiting for some confirmation. Once it comes, I'll start the class, okay? So winter is almost over in Delhi, and the time is now for the heat to come back. Some areas are still cold, but I think very soon will be, yes, hot everywhere. So how are you all? Okay, you can type in chat also, if those who are watching in the live chat. Okay, I think it started, so I'll start. Given a green signal from our students who are watching me. Okay, so I think I'll start. Okay, Rohit, Basil, Jenny, Afifa, Alan, JK. Okay, so basically, as you all know, it's a 4-day class in which we are going to study and discuss the important concepts in the physiology. Yeah, and as I know, physiology can be very tricky, but I'm telling you, okay, once you understand, it's not the easiest subject, because most of the things we discuss in physio are, very commonly seen, like blood flow, the blood pressure, the heart rate, the brain functioning, the motor control, the sensory. So that's why our idea is basically do in a very basic manner. Okay, so we'll be doing first basically the general and cell physiology. General and cell physiology. Once we have done the general and cell physiology, we will start the systemic physiology, that is systemic. In systemic, we can do is GIT. Some issue with still some centers. Okay, just waiting for that. Okay, Please solve it soon so I can start the class. Technical issues are always very, disturbing because you can't do anything. They are not in your hand. And we doctors are always in a, habit of getting things which are actually not in our hand. So that's why we are not always able to manage things in the way we want. Technical. So just wait some time, okay? Okay, so let's start. I think now everything is fine. So once again, good morning. How are you all? I hope all are doing well. So let's start the session. Let's study and learn about the physiology. So without wasting time, I'll directly start with the topic of our general physiology and cell physiology. Systemic will start afterwards. So let's do it in one session and solve all the recent question also. So session will cover PYQs also, and also will cover the upcoming or important topic. Okay, I cannot say upcoming questions because I don't know the answer of the upcoming questions, but we can make a good guess. One of them will be from the receptors, transporters, and all the glutes, SGLT. They're the favorite topic of examiners, always ask in the exam. So as we all know, the life, everything is made up of what? So everything is made up of cells. Okay, so that's why cell is the unit of life. So cell is the unit of life. Okay, okay, this is the cell membrane. This is the cytoplasm. Okay, and the cytoplasm is the one which contain the nucleus, very basic stuff, and cell organelles. So that's a basic thing. Okay, on the other hand, the cell membrane is the one which is the most important stuff here, mainly for our functioning. It is 7.5 nanometer thick. So very thick, 7.5 nanometer thick, and what are the specialty? And best is Singer-Nicolson fluid mosaic model for the cell membrane. So whenever they ask these kind of questions are nowadays not asked much. They're like naming the scientist of photo. It was there once when the NEET started in the beginning 2012. They gave photos and asked which scientist is this. So nowadays these things are not asked. Next question. Okay, so what does this finding about the fluid mosaic model is or would be? So whenever they ask these kind of questions are nowadays not asked much. Okay, so audio quality is clear from my end. Okay, it's not having any issues. So kindly check from the other end because I have checked my own end. Okay, once again I'll check from this end. Yeah, it's already fine, not a problem. I can just say, yeah, it's going fine from my end. Yeah, okay. Fine. Now let's see what is the property. So cell membrane contain lipids 40-45% and proteins 55 to 60%. So technically what is more? The proteins are more compared to the lipids in the cell membrane. Okay, so what is more? Proteins are more. Proteins are more than the lipids, and the lipids, main lipids are phospholipids. Very, very important. Phospholipids, which is PL. The word is PL. Phospholipids. Okay. Okay, I'll increase the audio from my end. Okay. Okay, so I've increased the audio. I hope it works now. So please do tell if the quality is. So I've increased the volume. Now it's much louder. Just check it, please. Okay, once again check it. I'll increase further if needed. So I already increased by, yes, 40%, around 35-40%. Please check now. Please do inform. Chalo, okay, fine. Thank you, thank you. Buffering. Now buffering is not in my end. My end was voice, so I increase the volume. I'll put the mic slightly above also. Now, should I start? Okay, fine. So the main lipid that we see are the phospholipids, PL, and the PL are amphipathic. Now, what do you mean by this word amphipathic? That means two ends. They have two ends. Okay. Now, what are the two ends? One is they have a polar head ends. Polar head ends. Okay. Which is basically made by phosphate. Okay. Made by phosphate. And non-polar polar tails, non-polar tails, okay, made from lipid chains. So that is how they look like. So they look something like this. Now the head, which is this is the head and this is the tails. Now what do you mean by the word polar? Polar means something which is having a charge. So polar basically means what? Let me show you. So when you say the word polar, it means something having a charge. And when there's a charge, it becomes highly water soluble. So remember, so they are water loving. They are hydrophilic due to polar nature. Whereas the tails are hydrophobic. So tails are hydrophobic. So they hate the water. So problem is water is present everywhere, but the tails don't love the water. So that is why we need to hide the tail between the heads so that when the water in the ICF and the ECF are present around the cell membrane, They don't have to face the water. So that is why the phospholipids, they are arranged as, yes, phospholipids are arranged as bilayer with heads outside and tails inside. Clear? So that is how they actually look like: heads, tails, heads, tail, head, tail, head and tail. And this will repeat multiple times, and that is going to give rise to our long layers, and that is how our cell membrane is arranged. Okay, now what about the proteins? So proteins are there inserted in the membrane. So what is this thing? Is this purple color thing? They are the proteins. Okay, so what are these? These are the proteins. So let me now label them. So these ones are only at one of the ends. These are called as peripheral proteins. And this purplish ones, these purplish ones, these are called as integral or transmembrane protein. So they are our integral or transmembrane protein. So they are the transmembrane protein. So they are which proteins? Transmembrane proteins. Okay, so transmembrane proteins. Okay, and why they are called as transmembrane? Because they are through and through the membrane from one end to the other end. So that means what they do in a cell, these proteins allow the movement of substances across the membrane through the membrane proper. So that is why they act as channels or pumps or carriers, etc. Receptors, so many functions which we'll discuss soon. So that is the function performed by our transmembrane protein. Okay, now what are the function of lipids in the cell membrane? So what we are seeing, function of lipids. In CM, cell membrane. First function of the lipids in the cell membrane is, right? So first function of the lipids in the cell membrane is, right, it provides the integrity, that is keep everything together. So structural integrity. So it is structural integrity. Number two, also provide the flexibility, fluidity. So flexibility and fluidity. Okay, so they provide flexibility and fluidity mainly due to unsaturated fatty acids. So which fatty acids? Unsaturated fatty acids, okay, and cholesterol. Third property, very very important, is also they are responsible for which all functions or which all things. So next is they are also responsible for which all function? Yes, they are basically providing solubility. Now what does that mean? It means the fat soluble, that is mostly non-polar substances, can easily cross the cell membrane. So how do the fat soluble substances manage to enter or leave? The answer is they are because of their, yes, lipid solubility. Example, gases. Remember this rule, gases are one of the most highly lipid soluble substances. The reason, gases are not polar, okay, most are having no charge because they have covalent bonds if you go in chemistry, and that's why they can easily cross the membrane. So oxygen, carbon dioxide, ammonia, all the gases, okay, that's why they show what, they show our, yes, diffusion, direct diffusion, okay. So gases, then our fat soluble vitamins, ADEK. Same way, fat soluble hormones, which are thyroid and steroid. So in short, I will just say one word, that is everything which is fat soluble can easily cross the membrane. But not everything is fat soluble. There are so many things which are water soluble. So they cannot cross the lipid cell membrane. So they have to go through the, yes, proteins which act as the carrier, transporters, etc. So the water soluble substances use the use the use the okay, proteins of cell membrane. Okay, so use the proteins of the cell membrane. Number one, ions, they use channels or pumps, any of the two. So they use either channels or they will be using our pumps. Okay, so either channel or they will be using the pumps. Okay, so any of the two will be used up by them. Clear? So channel or the pumps. Okay, next, number two, solutes. Okay, okay, fine. So solutes like sugars, amino acids, urea, etc., they use proteins called as carriers or transporters, like which carrier or transporters? Carrier or transporters like GLUT. So GLUT is a glucose transporter. Then number three is hormones. Okay, so neurotransmitters and water soluble hormones like insulin, growth hormone, okay, LH, FSH, etc. Okay, I'll decrease the mic input. See, there's a gap between the polar heads, okay, Abhinav? There's a gap, okay? Through the gap, these things pass, okay? Like, I'll explain now, okay? So, substances can pass through this. This is how they will pass, okay? And the water soluble, they will go through this. So, there would be a tunnel-like thing. Let me explain. Like, this is the tunnel-like thing through which they will be passing, okay? So, that is how eventually almost everything is able to pass the membrane. Now, you got the idea? There is a hole. This hole allow, clear? So that is how things which are lipid soluble can easily go through the lipid chains, okay? And the ones which are water soluble has to go through this. Like, this is the protein, it make a tunnel, so through which my pen can go, okay? Whereas my sound can go even through the walls. Hello, hello. So that is what the lipid soluble is. So lipid soluble can go directly through the lipid layers, whereas the water soluble, they are not sufficient to go through the lipid chains. They have to go through proteins for their movement. Are you clear, Abhinav? Okay. Next question. So what they do? They are big, so they cannot enter the cell because they are very big. So that's why they can't enter the cell through any of the transporter. So they can't enter because they are very big. As big size is there. So big size prevent this. Hence, they act inside cell via cell surface receptors. So what they are using? They are using the cell surface receptors. Are you clear? So what they are using? The cell surface receptors, okay? Done. So cell surface receptors, okay? Then number 4, proteins of cell membrane can also act as antigens, or cell markers. Example. What are the examples of the antigens or the cell markers? So they are as follows. So let me explain. So they are as follow. Example, yes, HLA, or our very famous MSC complexes, or we have the ABO antigens, or we have the CD, etc. The cluster of differentiation, okay? So that means the proteins are the one which are responsible for bulk of the immune response. So that is why all the proteins of cell membrane technically can act as antigens. In fact, receptors can also act as antigen. Example, in myasthenia gravis, the receptor for the acetylcholine becomes the antigen in this case, and the antibodies will damage it, causing the decreased motor activity and the flaccid paralysis, resulting in the myasthenia gravis symptom. So that is why the proteins are mainly acting as antigens here. And number 5 is water. So water is again not able to cross the lipid membrane. So water use aquaporins, which are water channels. But here comes the interesting question, okay? Aquaporin allow molecule by molecule entry of water, like one molecule of water, second molecule. If you want bulk amount, like example, I want to make my house. So I need not one bucket of water or one glass of water. I now need tank full of water. So that means when you need a bulk amount of water transport, the aquaporins are not the right solution. Now we need a transport which allow bigger substances to move. So remember, bulk, solvent, or substances like proteins or bacteria, okay, need spatial transport, called as vesicular transport. So this transport is called as vesicular transport. Okay, why it's called as vesicular? Because in this case you make a vesicle around the substance with a membrane, and this is transported in and out of the cell. So this is of two types. One is endocytosis and exocytosis. Endocytosis is basically entry inside the cell, and it is two types. Either it is phagocytosis, that is cell eating, or it is pinocytosis, that is cell drinking. So very simple, either it is cell eating or cell drinking. Exo, on the other hand, what is exo? Exo is used for throwing out the substances. So it is used for secretion of hormones. Phago, we already know, is for bacteria and yes, ingestion of debris or dead cells. So it is secretion of hormones, neurotransmitters, growth factors, etc. And what is the trigger? Trigger is calcium. So what ion trigger the response? The answer is simple. It is triggered by our calcium ion. So calcium is the trigger. One last thing, there's a protein called as clathrin. It helps in receptor mediated endocytosis. So receptor mediated endocytosis. So clathrin help in which process? The answer is it help in receptor mediated endocytosis. Okay, so that is the name of the yes processes. It is receptor mediated endocytosis. Okay, now we'll discuss the body fluids. So first thing about the body fluids is how much is it? So if you take a average human, around 60 to 70% of body weight is water. Okay, so it is called as TBW. What is TBW? It is total body water. So what is TBW? It is total body water. Okay. Second question, is it same everywhere? No, it is less in females. It is less in females and obese people. So females and the obese people have less amount of this case. Okay. Reason? Obviously, due to more adipose tissue. Fine. So it is due to the higher amount of adipose tissue. So let's do a simple calculation. Let's say a person's body weight is 60 kg. So how much will be the 60%? Is total body water, 36 liter. Okay, now I'm telling you something very important. Okay, please pay attention, and those who are giving in July or maybe next year, remember, for past 5 years there's no mathematical questions in the exam. Okay, but in the recently held FMG exam they gave calculator not that manual one, but the calculator was there in the, yes, the exam software. The software had a button where if you press, the calculator will open, and in this calculator, yes, and they got 3 MCQs which were calculations. 3, yes, calculations they got. So my advice, those who are preparing and giving the exam, NEET PG also, be ready. Mathematical questions can be there in your exams, mainly from biostats or any other field of PSM, or maybe by chance physio also. So be ready. If they ask for calculation, we have very few formulas. Okay, one of them they can ask is about the calculation of the body fluids, or maybe about the resistance or flow, etc. So I'm just already telling you, calculate this. Okay, so I'm doing all the mathematical questions also in the class. Okay, so total body water is 36 liters. Now it is 2 divisions, ICF and ECF. Okay, ICF is 2/3 and the ECF is 1/3. So that convert to how much? Around 12 liters, and that is 24 liters. Now ICF, as we all know, is intracellular, so it is inside the cells. So it is inside the cells, all cells. Whereas ECF, which is outside the cell, is 2 divisions again. One is plasma, which is 25%, and the other is interstitial fluid. This is 75%. So this is 75% is the interstitial. I'll use it IF. So if you want the percentage term, I'll write down. So in percentage term, it will be around 3 liters. It will be around 9 liters. So 3 liter is plasma, 9 liter is our interstitial fluid. Now where is the plasma present? Let's see. So plasma is inside the vessels. Okay, so it is inside vessels. Second, it is blood minus cells. And interstitial fluid. Let's discuss that. So interstitial fluid, it is outside the vessel. So it is not inside, it is our outside the, okay. So clear? Okay, so interstitial fluid. Second question, so what is it? So first is also called as AKA. So the other famous name. So it is also given a very famous name. What is that? It is also called as, yes, extravascular fluid. Why? Because outside the vessel. So that's why it is our extravascular fluid, because it is located just outside our, yes, vessels. Second, it is between vessels and cells, and collections of cells is tissue, hence called as tissue fluid. So it is also given a name, that is our tissue fluid, is the other special name. So the other special name, it is our tissue fluid. Now second question about this. This tissue fluid help form lymph. So technically, what is lymph? Lymph is nothing but interstitial fluid. Okay, now comes the interesting question. The question is, then what are the difference between plasma and interstitial fluid or lymph? The answer is IF and plasma are similar. So they are similar, but what is the main funda? Tell me. But no plasma proteins in IF. So please remember, the plasma proteins are absent in the interstitial fluid. So clear? Done? Okay. Next question. Next question. I am giving a summary. Please follow the summary and it will help you understand not just physio but also the lots of concept in medicines. Okay. Okay. So best wishes to everyone who's preparing for the exam, and my advice is simple. Please stick to your basics. Okay. Don't try to learn each and everything or go for the highest possible, because people ask me, sir, Darrow-Yanet curves, are they very important? I tell them not that much, because the chances of asking the Sigurd-Anderson curve or the Darrow-Yanet curves are very less. 99% question will be from your basic important topics like we are discussing, the fluids, okay, inflammation, the mediators, all the neoplasia. So I'm just giving a summary. This summary is going to help you discuss and learn it in this case. Are you clear? Chalo. So we'll start now. So first is we will be discussing in the following way. Okay. So understand, these are cells. So this is the cells. Okay. And they contain ICF. Then this is our blood vessels. So they carry the plasma. So this is the vessel. It contains the plasma. And this is our interstitial fluid, IF. Got the idea? And it flows out as the lymph. It becomes the lymph. And what is this two combined called as? So these two combined, we can call them as ECF. So this is the diagram that is there. Okay. Can you see that? Now I have a question. So this is our thing. Second, all the glucose which is present in the plasma, it diffuses to the interstitium, and from the interstitium it diffuses to all the cells via the glutes. So these are the glutes through which the glucose will come. Are you clear? So in simple language, the interstitial fluid is the provider of all the nutrition like oxygen, glucose, amino acid, fatty acid, whatever they need, they all get it through the interstitium, and the plasma is giving it, and the the conducting medium is IF. So IF is actually like a liquid culture media. So now what happens is, this is our external world. So this is our which world? This is our external world, and it contains good, bad, everything. This is our body. So this is our body. So these are cells. So let's say our skin get breached or any epithelia. So these are, let's say, epithelial cell. So as they are breached, the bacterium will make an entry into the body. So let's say this cell lining is breached. So now what happens? The bacteria, the pathogens from the external world, they make an entry. And where are they going to go? Let's say I'm making some gram positive cocci, let's say some staphylo. So this bacteria enter the interstitial fluid, and I told you it is similar to plasma. So does it contain glucose? Yes. Amino acids? Yes. So that's why the bacteria start proliferating. So two things are important here. To kill them, the WBCs which are present in our blood vessels in the form of our cells, they are now going to go outside. And these WBC immigration into this is one of the inflammatory cellular event. Okay. And once they go there, the blood supply increase, which cause the vascular events. And also there is immigration of WBC, that is diapedesis, all this. First there is, yes, rolling, then margination, sorry, first there is, yes, the cells are going near the margin, so this is margination, then there is rolling, then there is adhesion, then there is diapedesis. So all these events are occurring and the WBCs are going outside. Now as they kill the pathogen, it is our acute inflammation. Okay, if they are able to kill, and then the epithelium grows over, it closes the wound, sometimes pus is formed which can be drained out, and once the bacteria is killed, the infection inflammation is over and new cells will cover up. That is the case. Okay, but in case they fail to kill the pathogen, then it becomes a chronic inflammation and there is now a preventive coating around the pathogens with the necrotic material inside. This is called as a granuloma formation, which is chronic inflammation. Very simple case. Second, the bacteria can spread to other interstitiums, so that's why the lymph nodes increase in size, and that is why all the draining lymph nodes will increase in their size to increase the number of the WBCs to prevent the infection from spreading, and also the killing of the bacteria will take place. So that is why lymphadenopathy is a very common feature of infections. Okay. Second, all the X-ray, that is radiation, or the viruses, or maybe even the, yes, other factors like drugs, they all act on the cells, and as they act on the cell, they cause mutations, and sometimes this mutations can lead to proliferation of the cell, and as the cell proliferate, now we can have multiple cells which are present here, and these cells okay, so these are the cells, so now they have become a neoplasia. Are you clear? So that is how neoplasia occur. Now this neoplasia, the cells, if they are together and not going anywhere, it's a benign one, but once the tumor cells start dropping, they will go to which area? The interstitial fluid, and that goes out as lymph. So that is why lymph nodes are the first site of metastasis for carcinomas. So that's why are first site of metastasis. Okay, for this, and that is why a surgeon is going to do the sentinel node biopsy to check whether the metastasis has started or not. So that is very, very important concept, but they all are related to what thing? That the cells are having the interstitium which goes and drain into the lymph nodes as the lymph, and also the exchange between the blood vessels, the vessels, and the cells, it occur through the interstitial fluid. Next is we are discussing how do you measure all these chambers. So the topic is estimation of body fluids. So for the estimation of body fluids, what is needed or what is required? So for the estimation of body fluids, what is the requirement? So first question we use by dye dilution method. So this is responsible for what? This is responsible for estimation of our body fluids. Okay, clear? So body fluids is the case. Done. Next question. Okay. So what is the principle? It say if I want to measure, let's say, volume of this box, what I can do? I can add a dye, and as the dye mix up with the liquid inside, it will lead to what? It will lead to a uniform concentration. And if you know the concentration by a small sample, you can easily calculate the volume. So it says that volume of chamber is given as amount of dye, okay, given minus yes, excreted, divided by concentration of the dye. So divide by the concentration. So this is how you get the formula for the calculation. Okay. 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 Next question. Okay. Now let's discuss the dyes use. Okay. For the estimation. First, for the ECF, for our ECF, okay, here first we'll start with body water. So total body water. What are we going to use? So for total body water, what we will be using is our which dye? So we use heavy water. Now what is heavy water? Heavy water is basically similar to water, but it is not using water but isotopes of water, so that we can differentiate it from the body water. So that is why we use heavy water. Okay, example D2O and T2O. What is that? That is deuterium oxide and tritium oxide. Okay, so deuterium oxide and the tritium oxide. So these are the two forms. Okay, D2O and T2O. What are deuterium and tritium? They are basically isotopes of hydrogen. And tritium. So these are our isotopes of which thing? Of our hydrogen. Okay, so they are the isotopes of hydrogen, deuterium and tritium. So deuterium and tritium. So deuterium and tritium. Okay, deuterium and tritium. Okay. Number 2, ECF. For the ECF, you want a dye which should stay only in the ECF and not enter the cell. So dye should stay in ECF and not enter the cells. So the dye should not enter the cells. So it will remain where? It will remain only in the ECF. Okay. So that's why we use a dye which is, yes, not entering the cell. Example, inulin. Why? Because it is a very big sugar. It doesn't enter the cell. It stay only in the ECF. So it's a polymer of sucrose. Of fructose. Very big in size, doesn't enter the cell. So it doesn't enter the cell. Why? Very big size. Number 2, sucrose. It's a disaccharide which is glucose plus. So it is glucose plus fructose. So it is glucose plus the fructose. So glucose plus the fructose. Done. Number 3, plasma. For plasma, we want something which should be only in the plasma, not anywhere else. So that's why we use what? So that's why we use radio isotope labeled albumin. So what are we using? We are using radio isotope labeled albumin. So what are we using? Radio isotope labeled albumin is the case. and or Evans blue dye. Evans blue dye. Number 4, the ICF can't be measured by dye because you cannot put the dye directly in the cell. So ICF is given as total body water minus ECF. And number 5, IF is given as ECF minus plasma. So these are the case. So now I'll give a summary and then I ask you questions. Let's see whether you can answer or not. Okay, so let's recreate the exam scenario. So summary. So total body water has 2 parts, ICF, ECF, 2/3, 1/3. ECF in turn has 2 parts, that is the IF and the plasma. IF is 75%, plasma 25%. Okay, and IF and plasma are similar, but it doesn't have the plasma proteins. And how do you measure them? The answer, volume is basically the amount of dye divided by concentration of dye. That is the formula. Now, what are the dye we use for total body water? We use basically D2O. For ECF, we use inulin. And for plasma, we use albumin, radio albumin, or just write albumin. So this is the summary or the main point we need to remember in this case. Okay, so let's see some of the important questions and how these questions can be solved or discussed. Okay. So let's discuss. So let's say this is our July 2024 and they are giving the exam. So the question is like this. Let's say in that exam, it's a graphical question. So let's say a question come like this, okay? And now I will make it easy for you by giving a visual representation. This is a dye injected. So this is the dye injected, okay? So now the question is, have a look at the question and tell me what could be the possible dye that they are injecting. So I'll start with this. I hope you can see this dye. This dye, and this is the last one. Try to have a look at this. So this is the question. Is it buffering? I don't know. I gave a question to you. It's going fine from my end. Okay, so just waiting, then I'll ask the questions. Okay, chalo, okay. So before my question, they have started answering. Okay, so my question is very simple. What is the orange dye? What is this purple dye? What is this blue dye? So what is the dye number 1, dye number 2, dye number 3? Okay, Narendra has given the answer. Okay, let's see other people. So look at the orange one. So orange one is only in the vessel. So orange one is only in the vessel. That means it is measuring the plasma. It's most likely albumin for plasma. Very good. Yes, very good. Okay. What about the purple? Purple is in both IF and plasma. That means it is measuring the ECF. So it is most likely measuring the ECF. So what is the most likely answer? So most likely it is our yes. So it is ECF inulin. Very good. KD, Dr. KD, FJ, Shafna, Revati, Dr. Garg, Shailaja, Sahana, Prohit, Shifa, Narendra, KD. Very good. Okay. Yeah, it's right. And finally, the blue one has entered the cell also. So it is not ICF because it is present in the ECF also. So it is measuring ICF also, ECF also. So this one is measuring everything. So it is blue one is cell and ECF both. That means it is measuring total body water, most likely D2. Yes, Mad Life, you are right, Malini. So that is how the questions would be given in the exam. They convert the theory into either a graphical format or sometime they will give a trick question like a dye was injected in the body and it stayed only in the intracellular compartment or extracellular, something like that. Okay, and you have to find out what could be the location. Like a dye doesn't go to interstitium, like the language will be there. Okay, a dye doesn't enter interstitium. What it measure? Can you tell me what it measure? A dye doesn't enter interstitium. So what is it measuring? Tell me. Obviously ICF, ECF, plasma, interstitium. What is it measuring? Okay, let's see the answer. Yes, plasma. Very good. No, not ICF, it's plasma. It is plasma. It is plasma. Very good. Dr. Pranay, Malini, Shafna, Garg, Dr. Garg, Basil, Dr. Basil, Dr. Suraj, Dr. Afzal, Dr. Revati, Dr. RACAC. Okay, and Dr. Sahana Purohit. Okay, अब let's make the question tricky. A dye dye enter interstitium. What is measured? A dye, yes, Dr. Satya Rohit, Dr. Rohit, Dr. Satya. A dye enter interstitium. What does it measure? Anyone? So it is an interstitium. Yes, ECF. Very good. So that is how the language will be a bit tricky, but you should be able to solve it without any problem. Now there is a chamber called as transcellular fluid. Transcellular fluid. What is that? Yes, you're all right. It is ECF. First, It is part of ECF. Part of ECF. Around 1 liter. And include all the fluids in body chambers. All the fluids body chambers like pleural fluid or cavities, like pleural fluid. Okay, so pleural fluid, then CSF, peritoneal fluid, pericardial fluid. You got the idea? So all these are our fluids in the chamber and the cavities, which are called as transcellular fluid. Okay, so first question, why it is not called as plasma? Because not in the vessel. Then why is not called as IF also? Because it is, yes, not between the cells and the vessels. It is in proper cavity. So that's why all the cavity fluids, like even the if you count synovial fluid, it'll also be a part of this. Okay, so that's why all the liquids which are in chambers or cavities will include in the cavity transcellular fluid. Okay, now we'll discuss transport across cell membrane. Transport across the cell membrane. So first question is, how does the transport occur? So it's two types, active and passive. Now what is the difference between active and passive? So obviously active means use energy. So active means use energy. So it use energy, ATP. Why? As it is against gradient, that is uphill, that is low concentration to high concentration. So anything which is going from low concentration to high concentration is active. It is our active. Whereas passive is reverse. It is low. So what is passive? It is low. So first is, it is reverse. First, no energy needed. No energy needed. Second, direction. It is from yes. Yeah, you can say it is third space fluid. Okay, technically it is the interstitial which is there. Okay, but you can count it there. Okay, Akshay. So along gradient. Okay, along the gradient. Okay. Okay, so no energy is needed and it is downhill and it is from high to low concentration. So it is going from high to low concentration. Okay, now I have a question. I'll give example. You tell me which is active, which is passive. Okay, so study and forgetting. So what is active, what is passive? Study and this. Just 1 second. Okay, I'll get my waters over. Study and forget. Just tell me. So third space is actually IF only. Okay, so study is active. Why it is active? Because obviously you are going in what direction? You are going from low knowledge to high knowledge. So it is active. Forgetting, you don't study, so whatever you have is all gone out. So it is passive. That is why I take lots of effort, energy to study and become a good doctor. So that's why, yes, Gaurav, you are right. Study is active, forgetting is passive. Okay, don't study, you forget in a single day. Okay, earning and spending. Earn and spend. Yes, Dr. Saveshya Safna. Yes. Earn and spend. What is active? Yes, you are all right. Yes. New question. Okay. Earning. You are here. So your bank account is 0 rupees and you want to make it 1 lakh or maybe 1 crore or maybe, what, 100 crores, 10 crore. So obviously you are going against active. Earn is again active. Spending, very easy. As you buy things, the monies decrease. Okay, so that is why now you got the idea. Okay, so therefore if you want to earn, you have to work hard. So that is why everything require energy, everything require this. Okay, so in our body the example is pumps. Here the example is what? Is diffusion. For everything. So remember, all passive are diffusion, but osmosis for water. Yes, Dr. Faisal, Dr. NC, Madlife, Revati, yes, Shafna, yes, Gaurav Kansal, you're right, yes. So osmosis for water. 100% right. So I think everyone is clear. Okay. Now, next question is the types of active. So two types of active transport. So what are the two types of active transport? So the two types are primary active and passive, secondary active. So primary active and the secondary active. Now, what is the funda about primary active and about the secondary active? So first is primary active. The funda is very, very simple. It is, yes, direct use of energy. Use of energy. Okay. Example, 80 PS pump. Whereas secondary is an indirect use. Indirect use. Okay. How? Basically, they are transporters coupled with a pump. Coupled with a pump. So any transporter that is coupled with a pump, example, sodium symport. Sodium or antiport. So sodium symport or antiport. Let me explain. Pumps are primary, papa. So pumps are primary and sa. Sodium symports are secondary. Sa. So remember, whenever the term comes sodium or symport, it is secondary. Pumps are always primary. Okay, why? I'll give an example. Let's say there is a bus. Bus is full and you want to enter the bus. So obviously you're going against the gradient. So that means you need energy. Okay. So if you use your energy to punch and kick, and you push people and enter the bus, it's the active transport, primary active, because you use your energy to enter the bus. Like when Papa go to office, Papa has to push inside the metro or bus. So Papa using own energy to transport himself is a pump. Done. So pumps have ATPs which break the ATPs, use the energy for moving the ion in this case. Okay. Whereas let's say Papa is going to office and son say, Papa, I also want to go to office, so drop me to the school. So now son is the transporter, let's say glucose, amino acid, iodide, bicarbonate, anything. Now the pump will now carry the substance along with this and pull it inside. So now what happened? The Papa is punching not just for himself but also for the son. So who is giving the energy? The pump. But who's coming along with that? That is your glucose, amino acid. So glucose becomes secondary active. One more example. Your friend is coming on bike. So whose bike? Friend. Whose petrol? Friend. That's primary active. You sit at the back and he drop you to whatever location. So that is secondary active. You got the idea? So when any transporter is coupled with the pump, most famous pump is sodium potassium pump. What they are coupled with? They are all coupled with very famous sodium potassium pump. That is why sodium is, yes, if pump primary active, sodium coupled with any other thing becomes secondary active. So examples of secondary active transport. So first is sodium amino acid symport. Then sodium iodide symport. Then sodium glucose symport, also called as linked transport. I told you na, anything which is linked with sodium is secondary active. What is the short form? Or SGLT, sodium glucose linked transport, and it is one of the 100% sure exam question. So it is one of the 100% sure exam question, that is SGLT. Okay, now it is two types. Now how to remember them? Very easy. How many kidneys we have? Two. So it is in kidneys. And intestine is one, from oral to the anal end, so one intestine. And first time we eat, the glucose comes to the intestine, so one intestine. Kidney is dual, kidney is dual. So kidney is double and intestines is one, so 1 and 2. So kidney is 2 and intestine is 1. Okay, now we discuss the passive transport. Passive diffusion follow Fick's law, which I'll tell very soon. Follow Fick's law, and two types: simple diffusion and facilitated diffusion. Okay, see, all I told you, antipode, symport, all. Okay, whether it's a symport, whether it's an antipode, any transporter, the moment they mention the word sodium with a port, 99% is going to be a second reactive. Are you clear? So that's why if they mention ATPase or pump, remember it's primary active. If they say port, sodium port, you mark the second reactive. Okay, Dr. Basil Mohammed, that is my simplest advice. Okay, because yes, we must know the basic rules. There are exceptions which I will tell you whenever they come, but right now the rule is simple. If it is a pump, it's a primary active. If it is a symport, especially of sodium or any antipode, the answer becomes secondary active. Okay, now simple diffusion and facilitated diffusion. Now what is the difference between the two? In simple, there is no carrier or transporter. No carrier or transporter use. So what is not used? No carrier or transporter use. Okay. So there is no carrier. Example, oxygen CO2 diffusion. Okay. Here the carriers are used. So carrier is used. Example, glut or UT, that is urea transporter. Now question that is asked is, what is the other difference? The other difference is the follow saturational kinetics. Now it's a very important topic. What is that? Okay, that is they don't follow. So who will not follow saturational kinetics? So what follow? Simple diffusion. What will not follow? Sorry, what follow? Facilitated. What will not follow? Simple diffusion. What does that mean? Explain. Basically, it says that the Vmax depend on the number of transporters or carrier. So depends on number of carriers. Okay. And on the other hand, here the velocity or the rate doesn't depend on carrier because there's no carrier, but rather depend on concentration. Here velocity of diffusion depend on concentration. So that's why they will not get saturated. More you give the concentration, more the rate will increase. Here, even if you increase the concentration, the rate will not increase. So that's why the velocity can reach a maximum value, but not above that. Here there is no Vmax. Reason? They never get saturated. So never ever get saturated. So please, please, please don't ever forget this. Next question, right? Okay, let's continue. So I'll make a diagram and ask you to check. This is the rate or velocity. This is concentration. Okay, So you are given a choice to diagram. Let's see which one is what and you will get it or not. Okay, so let's see. So these are the two curves and your work is very simple. Tell me whether they are there or not. Tell me. So which one is one? Okay. Tell me. Okay, Dr. Garg gave. Let's see others. This is low concentration. High concentration. See, so in this case, the rate has reached a Vmax. Now the Vmax remain the same. That means there is a saturation. It is saturated. The rate is not increasing. So even if I add more molecule, the rate will not increase. So that is why once the transporters are all used up, the rate will not increase. In this case, the rate keep on increasing. So this green one is not saturated, it keep rising. So theoretically, it can increase to infinity. So that is why the green one is our simple diffusion. And this one is what? This is our facilitated. Okay. So I'll give you a summary and a question. Let's see. Very good, Dr. Suraj, Dr. Shafna, Dr. RAC, Dr. Revati, Dr. Malini, Dr. Garg, Dr. Basil, all are right. Okay. So now I'll give you a question and let's solve it. Okay. So first, summary. Summary. So summary is simple. If they give pumps, mark primary active. If they give us import or any port and especially with sodium, it could be potassium also, but mainly it's sodium, so it is second reactive. Yes. Then if it's a transporter carrier but without sodium, no sodium, then it is facilitated. And if nothing is given, then simple diffusion. So please copy this. Yes, you are right, Dr. Sebastian. Okay. So now this is the story. Pumps, primary, symport, secondary, carrier, facilitated, nothing is simple. If nothing is mentioned, go with simple. Okay. So let's solve the question. So this is actually a NEET PG 2023 5th March physiology question. And I'm reproducing the question exactly as it was there in the exam. So exam was like this. There was a semi-permeable membrane, okay, with a dotted line. Then they showed the molecules like this. Exactly like this, okay. And then they showed something like this. green, exactly like this, and then this was shown. Like it was actually attaching and then like this. Okay, so this was the question, and I will ask you what will be the most likely answer. So it's which kind of transport? The options are same. Okay, first tell me it is active or passive, because that will solve half the question. Tell me it's active or passive. See, it is high concentration, it is low, so obviously it is not active, it is passive. So one thing is clear, it is passive. So it is passive. Now passive is two types. What are the two types? Either it is simple or facilitated. Which one? What do you think? This is most likely, the green stuff is most likely a transporter. So it's a transporter or carrier for this molecule, carrying it to the other side. So what is your best answer? Is this simple diffusion or facilitated? Yes, it is our facilitated diffusion. Okay. And if they remove this, if they remove it and then show the molecule going, now it will be simple diffusion. Now it becomes simple. Are you clear? So now it becomes simple, and if they show a molecule or stuff like this, now it become, yes, opposite, so it's active. Now it is active, and since I told you, if they don't mention sodium or something, always mark it as pump. It's most likely a pump. Okay, if they mention sodium ion, then it become a yes. So that's why they have to mention sodium. There's no mention, so we'll go with pump. So I think you are getting the idea clear. Yes, yes, yes. You're all right. Yes, you're all right. Chalo. So now we see the topic, then we'll take the break. So the topic we are discussing is our cellular junctions, here cell junctions. Okay. Yes, you're right. So sorry for my bad handwriting. I know by now you all would have noticed my handwriting is just like a doctor should be. So very bad handwriting. Okay, but again I cannot change it. I tried to change my handwriting, then it was impossible. Okay, so therefore, yeah. So first is we have the very, very famous, very important, the tight junctions. They are called as, yes, macula. Yeah, better we write zonula occludens. Okay, made by what? So what are they made up by? So they are made by, yes, proteins, occludin and claudin. What is the function? They create barriers and prevent mixing of two chamber fluids. So two chambers are segregated thanks to the tight junction. Like example, blood brain barrier. What it separates? Blood from the CSF. Then placental barrier. What does it separates? Obviously again the blood, maternal blood, from the amniotic fluid. blood testis barrier. So blood testis barrier again is very important, it segregates. Then we have the kidneys. Okay, why? Yes, GIT epithelium. I'll put etc. So kidney, we have urine one side in the tubule, and other side of the epithelial cells of the tubule, there is interstitium and the blood vessel. Do you want them to mix? No. So again we have the barrier. So these are the barrier. Let me just make a simple diagram. These are epithelial cells. Okay. Fine. These are cells. This is blood. And this is other fluid. Let's say this is CSF, or let's say urine, or amniotic fluid, etc. So now they will mix up easily. So that's why to prevent the mixing, we need to seal this space, and this space is sealed through this stuff. So this is tight junctions. Okay, so that stuff I made is tight junction. So this is tight junction. Okay, so that is how tight junctions will operate. Are you clear? So they're made by this zip locking proteins like this. They are called as the, yes, our tight junctions. Okay. Then number 2 we have is the desmosomes. They are called as, what are they called as? They are called as our, yes, macula adherens. And what are this macula adherens will do? Right? So basically they act as cellular cements. Okay, or glue. Keep cells together. So they keep the cells together. Okay, keep cells together. Example, this is the cell. Okay, and this is our basal lamina. So this is our basal lamina. So this is our basal lamina. Okay, now look at this. So these are our desmosomes. These are our desmosomes. These are. And these are called as hemidesmosomes. So hemidesmosomes basically connect the cells with their basal lamina. So that means they are what? The glues which are holding everything together. Now what are they made up by? So remember, they are made by what? They are proteins called as cadarins. And desmoglein, DSG, in skin, keratinocytes. So what holds the keratinocytes, or why leather is so strong? Remember, our leather is so sturdy, we can use it to make gloves and all the shoes. But the main secret, is the keratinocytes are very flat cell. They're like a tissue paper. So our keratinocytes, they are tissue. In fact, when you bath or scrub, the thing which is coming as the dust or whatever you can say, yes, the body waste is basically nothing but dead epithelial cells. So what is keeping them together? The answer is, it is the desmoglein. So if desmoglein is defective, what do you think will happen? Can you give me again correlation? So if desmoglein is defective, what disease will occur? The cell will not be together, so fluid will accumulate. So there is blisters form. Okay, the blisters are formed. What disease? Very good, you are right. Yes, pemphigus. Pemphigus. Okay, either fallacious. Fallacious is F4 for first. So DSG1. And if vulgaris, vulgaris is everywhere, most common. So even mucosal involvement, so that will be DSG3. So that will be DSGG. So I just want to show you something. I think it will help you learn, because that is what I do. So I try to revise most of the subject in my style. Okay, so I'll just give you an idea about the case. So let's say it is our, one second, show you. So these are the PDFs of the revision I took. These are our race sessions of the subjects. I took all the revision. I just want to show you dermatology one. Okay, so have a look at this. So in around 45 pages, rather 29 pages, I have covered all the revision of the dermatology. Okay, so like mnemonic, college girl study books, so all these layers are there. Okay, then the features, what are the findings, okay, all these things. Okay, then this tennis racket appearance, that is very common, Burbeck granules, all this are findings, and these are the case. So this is the mnemonic I want to show you. In blister disorder, that is pemphigus and pemphigoid. Remember, old, pemphigoid is old. So older people have the pemphigoid, and older people are always having a problem of blood pressure. Their BP is always high. So remember, mnemonic is BP. So their BP is always high. So BP is always high. Okay, and they are always in tension कि कब टपक जाएगा बुढ़ाऊ. So मतलब tension में. So tension में है बुल्ला. So tense bulla, because they are below the epidermis. So subepidermal, very tense, doesn't rupture. So they are tense but do not rupture. They do not rupture. Tense but do not rupture easily. Okay, so pemphigoid is old, that is 60 to 80 years, and old people have problem of BP and they are having tension ki when they will die. So tense bulla and BP antigen. Okay, this bulla is pemphigoid. Whereas pemphigus vulgaris, us, we are what? Younger people. Okay, so it's younger people, and remember, younger people are flaccid. Okay, so they don't have this tension, they are flaccid. So it is intraepidermal, that's why it rupture very easily, and when it rupture, the peeling occur, and that is called as Nikolsky sign. Peeling, तो इसको ऐसे याद कर सकते हैं ना, पपड़ी निकल गई Nikolsky. So Nikolsky is peeling when you apply tangential pressure, and there is a row of tombstones. So when the cells rupture, there is also loss of cell, so it's row of tombstone appearance, and finally fishnet appearance. This is negative in BP, so it is negative in BP. So they are present in our pemphigus. So just one word, pemphigoid is old, pemphigus is younger, the blisters are flaccid, they rupture easily, Nikolsky sign. Treatment, we give steroid, we can also, yes, plus minus methotrexate and dapsone. Dapsone is preferred mainly in the pemphigoid. Okay, so that is the finding. So it contains all the revision, all the finding, fallacious, DSG1, vulgaris is DSG3. It's very good for revision of all the important stuff in the end. So you can revise it very fast, like all this thing, linear IgA disease, this all things, okay. So they are very good, like acne, the mnemonic is come papa push cycle. So come is comedon. So comedon we give basically topical retinoids. Papa is papule, we give topical retinoid plus topical antibiotics, okay. Third stage is pustules, okay, pustule, that is push. So that is topical retinoids and oral antibiotics now, okay. And finally, if cyst and nodules, cyst is cycle, come papa push cycle, come papa push. So that is oral retinoids is given, which is teratogenic. So these are all the memes and etc. used to, yes, revise all the subject. So you can use them. They are available on YouTube. I can give the link if you want this PDF. I'll post in the Telegram group. You can download and you can revise. But it is best to revise toward the end. Right now, attend the full class. Then you can revise with the help of these memes and all the summaries very, very fast. Okay. And number 3 we have is our gap junctions. Gap junctions. They're actually first question. So they are openings across adjacent cell. Across, yeah, I'll share, don't worry, okay. Adjacent cells. Okay. So I take revision for a long time. Okay. It's not like I'm taking for just 1 year. I'm taking for past 15 years revision sessions. Okay. And they're all, I took last year also for NEET PG before the exam. Before that also I took offline, online. So this time also I'll take before the exam. Right now we are doing the regular classes. Okay. Chalo. Surely I'll share. Okay. So adjacent cells. So openings across adjacent cells. So they are across adjacent cells. Okay. 2 to 20 nanometer wide. 2 to 20 nanometer wide. Help in movement of current ions from one cell to another. Okay. So what are they helping in? They are helping in movement of currents and the ions from one cell to another. Okay. So that's why, okay. And what are the protein they are made by? And they are made by connection protein. Protein. And what do act as? So that's why they act as electrical synapses. Electrical synapses. Let's see how. This is 2 cells. Now, if you make a tube-like connection between the two, now what happens is if you stimulate the first cell, the current can flow to the other cell and it also gets. So now they are both stimulated together. Both cells stimulated together. And that's why it is going to act as a what thing? It is going to act as a electrical synapse. So it is now a type of electrical synapse. Okay. So clear? Now, what is the benefit? They are seen in heart, there is cardiac muscle. And visceral smooth muscle. Visceral smooth muscle. Example, GIT, uterus, bladder, etc. Okay. Now let me explain this in a very simple way. See, the shape of all these structures is like this. Okay, so these are the shapes, okay, uterus, etc. So when they have to push the content out, all the fibers should get excited at the same time and contract as a single unit, that is syncytium. So what happens is, so due to gap junctions, all the fibers, all the muscle fibers are excited at same time and contract as single unit. Contract as single unit called as syncytium. Syncytium, okay, syncytium. So remember, physiological syncytium is formed by gap junction. It is physiological, okay, and the anatomical is via intercalated disc in the heart. And remember, in heart, anatomical connection or the syncytium by intercalated disc. So that is anatomy topic, histology topic. So intercalated disc, they physically connect them. So that is physiological, anatomical, both are there, okay. So therefore, these are the summary. So I'm writing a summary, then we'll take a break. So summary. So summary is like this. See, so first we have the tight junctions. What is the tight junction protein? It is occludin. Occludin. And what is the function of this? It is barrier. It is barrier. Then we have the gap. What is the funda about the gap is? Tell me, funda about the gap. The gap is basically what? So gap is made by what? Gap. It is made by our connection, and the function is currents. Current transmission or syncytium, you can say, or connection. Then we have the desmosomes. Protein is cadherin, and the function is there for adhesion. Now what we do? Repeat them multiple times so that your brain make a connection, like tight occludin barrier, tight occludin barrier, tight occludin barrier, gap connection current, gap connection current, desmosome cadherin adhesion, desmosome cadherin adhesion, desmosome cadherin adhesion. So if you repeat it multiple times, it will help you remember them without any problem whatsoever, always and always. So my simple sincere request is what? Repeat and revise multiple times so that you don't have to worry at all in this case, okay? Fine. Chalo. So we'll take a break. We'll take 20 minutes break now. We'll start at 12:25 p.m. Lunch will take around 2 o'clock, 2:15. 2:15 p.m. lunch. Okay. So lunch at 2:15 p.m. Okay. Chalo. Thank you very much. Yes, you are right, Dr. Kamal Agarwal, Dr. Yes, Lakhon. Okay, Dr. Maddy, Dr. Doxycycline. Yes, best of luck to all of you. Yes.